Good afternoon, everybody, and thanks so much for joining us here on KXAN Live. I'm Will DuPree, coming to you from the KXAN Live studio. We appreciate you joining us because we're going to be talking about what a lot of you are wondering about, and that's the spread of monkeypox here in our area, what the latest information is, and we are getting some new details about what actions the city is going to take to address the spread of this virus. So if you take a look right here, just a few moments ago, we got a press release sent out to all the media outlets here in Austin talking about what the city council will do tomorrow. Now, they're going to be declaring and voting on the potential declaration of a disaster here in the area for monkeypox. This is on top of what they did yesterday when both Mayor Adler and Travis County Judge Andy Brown issued emergency orders related to monkeypox. So we wanted to break down what the difference between these two actions is. And joining us right now is digital reporter Grace Reeder. Grace, thank you for being here and for helping us to get a little bit of context for this.
Absolutely, Will.
Yeah, so again, emergency orders for monkeypox issued yesterday by the mayor and the county judge. Tomorrow, the council is voting on declaring a local disaster. Really, this is just an extension of what happened yesterday.
Right, so what leaders are trying to do is to free up the ability for resources to be brought here to Central Texas, and also, I think, largely to raise awareness about monkeypox. This is something that Mayor Adler said yesterday, saying we really just want people to know that we're worried about this and that we want to be able to tap into federal and state resources should they become available.
One question we've gotten since reporting about monkeypox has gotten a little bit broader for us here at KXAN is the concerns about what will happen when school starts. Again, many different districts are going to be having classes reconvene very soon, at least some as early as Monday next week. So one of the questions that we've gotten is about that. And Grace, what health experts have addressed time and time again is what parents are thinking about. So what have they shared in some of these latest updates that they've given about monkeypox?
Well, school districts right now are in full-blown trying to figure out the school year mode, and so a lot of them are saying, well, we're really looking to Austin Public Health to give us that guidance and that advice for those best practices, and Austin Public Health has told me that they are working with those school districts. They have confirmed that. We talked to Dr. Desmar Walks during one of their briefings last week, and she gave some really good, down-to-earth, I think a lot of parents just want to know, my son wrestles or, plays football or, they're going to be wrestling. These are kids during the Texas heat in summer, so, really, how worried do I need to be? And she said that really what parents need to be focused on is monitoring for symptoms, and it's really going to be about that monitoring that's going to help make sure that this doesn't spread among kids. So she asked parents to be really diligent with monitoring for fever and, getting kids tested should they end up having those pimple or lesion-like things on their bodies, and so really just being conscious and screening your kids.
And we should point out that yesterday, Dr. Walks pointed out that none of the local cases are in children at this time.
Right. Right now, it is largely men in their 20s and 30s.
And if you take a look, this is the latest numbers from Austin Public Health put out there about monkeypox cases in Travis County. There are 9 confirmed and then 59 presumptive cases. Grace, tell us what the difference between those two are.
Sure. So there's a pretty extensive process and frankly a slow process right now. Those presumptive cases are people who believe that they have monkeypox and may have tested locally, but to get those confirmed, they have to go through a CDC confirmation process. So right now the way that this works in Austin is if you've got symptoms, you go to a provider or you call Austin Public Health's nurse line to help connect you with a provider. The provider will test you, which right now can only be done if you've got those lesions. They do the tests on the lesions, and then after that, that test is sent to Austin Public Health. They bump it up to that next level, and so that testing takes time. I talked to a man here in Austin who ended up being one of those confirmed cases of monkeypox, and he told me it took more than a week for him to get those results back.
Just one of the other issues that we're running into here as the county and the city respond to monkeypox cases, I wanted to also share a story that the Hera Rahman reported last night talking about some of these concerns about returning to school and the spread of monkeypox. So take a look and we'll continue our conversation on the other side.
I love to meet my new teacher.
While some kids are excited about getting back to school,
Recess. Because there's an awesome play structure.
Others, not so much.
I don't really know.
And many of their parents have questions as monkeypox becomes a public health emergency.
We really do need our community to stand with us.
I feel it's the school's duties, or the school district's duties, to offer the best available information.
But one doctor says while it's possible for the general public to contract the virus, the risk isn't the same for everyone.
I think it's important for us to sort of pump the brakes and say, hey, we understand that 98 to 99% of the persons who have contracted monkeypox are MSM, or men having sex with men.
He says if you don't have prolonged physical contact with someone infected, it's highly unlikely you'll get it.
Highly unlikely that even if somebody has monkeypox in the same room with you, that you will get it from them just by being in the same room.
He says the risk doesn't compare to COVID.
The short answer would be they're not in the same galaxy. If you had to list a top 10 health concern for you to have, it would not be on your list.
An approach Audrey Silva is taking.
I think as long as we just pay attention and don't overreact and just take the correct steps to act, it won't blow up.
Back with Grace Reeder now, one of our digital reporters here at KXAN, and what that medical doctor there said just a few moments ago, highly unlikely about catching monkeypox there. And that really just reiterates what you have covered and have learned from a lot of experts here locally.
Dr. Alozzi is great. We talked with him a lot about COVID-19 as well, and he gives really down-to-earth advice. But this is what I have heard from most health leaders: is this is something to be educated about. This is something, to be watching. But it's certainly not a reason to, as Dr. Walk said, not let your children be children.
And really, we want to highlight how this is spread. A lot of people still have questions about that. So Grace, remind us what the likelihood of getting that is that you would contract this virus.
So the main way that this is being spread is through intimate contact, or if someone who has lesions. We have heard folks who have lesions maybe lay in a bed, and if you lay in that same bed and make contact with some of the liquids from those lesions, it can spread that way. It can spread through clothing, but really the main way that we are seeing spread here is from that intimate contact to contact.
Yeah, prolonged skin-to-skin contact they've highlighted over and over again. And if you want to find out more about what symptoms are involved and associated with monkeypox infections, they are available right now on KXAN.com because we've done so much reporting about that. Also wanted to highlight, Grace, you mentioned the nurse line. There's also this Austin Public Health Equity line. You can call this if you believe that you're a close contact with the monkeypox case and do not have a healthcare provider. That way you can get associated and have some resources available there. That number's on your screen. It's 512-972-5560. Grace, before we let you go, I wanted to ask you if you had anything else you'd like to highlight about what conversations medical experts are having and sharing about monkeypox here in our area.
Well, I think the other thing that I have been asked a lot is, can I go get vaccinated? We're hearing that from a lot of people, and right now the answer is just frankly no. And that's why what they did yesterday, what you're seeing here, that's something that they're trying to address. Health leaders and local leaders have shared frustration about the number of vaccines that we have gotten here in Austin. As of right now, we've only gotten about 3,000 and have requested thousands more than that. We don't expect to get more vaccine until the fall. And so the folks that are able to get vaccinated right now are those folks who have made contact with somebody who has monkeypox, or also someone who has a certain number of sexual partners over the past 14 days. But even then, there may not be vaccine available for all of those folks.
Thank you for highlighting that and for clarifying it for people, because again, those are a lot of questions that are coming out. Again, if you're just joining us, digital reporter Grace Reeder is here, and she's going to continue her reporting about monkeypox here in our area. And tomorrow we will be tracking that vote with Austin City Council, and they are expected to declare a local disaster related to monkeypox. So please stay with us as we continue that reporting. But Grace, thank you for being here. We do appreciate it.
Absolutely, Will.
All right, everybody. Again, we've highlighted that monkeypox resources and our reporting about it is available right now on KXAN.com and on the KXAN News app that you can download onto your smartphone. If you haven't done so already, please do so, because there's so much in-depth reporting there available for you. Thank you again for watching. I'm Will DuPree in the KXAN Live studio. We'll see you back here another time, everybody. Please stay safe and healthy out there, and take care.